Hello, listeners. From the RSNA, this is the Radiology Cardiothoracic Imaging Journal podcast. I am your host, Praveen Ranganath, and I am a radiologist from Dallas, Texas. In this podcast, we explore research advances and technical developments in cardiothoracic imaging through conversations with our authors, our editors, and experts in the field. Enjoy. Welcome back, listeners. On today's episode, we will be discussing a recently published review in the journal. The article is titled Cardiovascular Imaging, Climate Change, and Environmental Sustainability. The impacts of climate change are a super hot topic both in and beyond radiology, and the authors of this review have done a fantastic job summarizing the salient points. Today, I am joined by the lead and senior authors of the paper, Dr. Subhai Gunasekaran and Dr. Kate Hahnemann. Subhai and Kate, welcome onto the podcast.
Hi, thank you so much for having us.
Likewise, great to be here.
All right, excellent. Thank you so much once again for joining. But before we jump into the main topic, let's learn a bit more about you. So where do y'all both practice, and how did y'all get involved in the impacts of climate change from the perspective of radiology or altogether? And Subhai, why don't we start with you?
Sure. So I'm actually a PhD researcher. I'm an assistant professor at Cedars-Sinai Hospital in Los Angeles. And my interest in sustainability kind of stems from a longstanding interest in just global issues. In college and grad school, and even now I'm involved with water nonprofits helping the international water crisis. And then in grad school in Chicago, I was also serving as the president for the Chicago chapter of UN Women, where we looked at other international issues such as girls' education, women's economic empowerment, and health. And so when sustainability and MRI and imaging became a bigger topic of interest, I was very excited to get involved and learn more and work on these more international global issues that address our field.
Excellent, Subhai. Thanks for your contributions thus far to the field, and I'm excited to hear more about it from the perspective of imaging. Kate, how about you?
Well, I'm a cardiac radiologist at the University of Toronto, and while I've been interested in climate change and sustainability in my personal life for a long time, it took me an embarrassingly long amount of time to kind of connect the dots and figure out that this was relevant to what we do in our day-to-day work. And at first, I really thought of this quite like broadly, more as kind of like a broad, non-interpretive type topic in imaging, thinking about how we could reduce our energy, for example, and that's really where I started from. But in this article, as I know we'll get to, really connected it to my work clinically as a cardiac radiologist, why this matters, like particularly for those of us that practice in this space. And so that's been really awesome. And I just want to highlight, it's been so wonderful to work with Subhai on this. She was a former trainee editorial board member for our journal, which has been wonderful and was part of the genesis for really thinking about how we could talk about this specifically related to cardiac imaging.
Excellent. Thanks, Kate. And I think you've really hit the nail on the head there in terms of the perspective from the clinical imagers that are out there. We have an understanding of cardiovascular imaging and perhaps an understanding of sustainability and climate change, but linking the two may not have been something that many of our listeners are out there have understood as in a robust fashion. And I think your review, as well as the work that you both have done outside of this review, have been super impactful. Let's jump into that now. So the review itself opens with a brief discussion about the adverse effects of climate change on cardiovascular health itself. Could y'all help summarize perhaps where some of these data are coming from in the context of the diseases that we see on a day-to-day basis from the imaging state?
Absolutely. And thank you for highlighting this and acknowledging this is where we opened. And I think it's really important for us as physicians, especially both radiologists and cardiologists, but of course our scientist partners as well, to acknowledge we work in healthcare. This is, generally we are focused on trying to, support or improve patient health. And so I think a health-centered focus is incredibly important rather than, kind of having this narrow focus on energy or kilowatts or greenhouse gas emissions only. It's really hard for others to kind of grasp why that might matter to us as physicians. And as I alluded to before, it was even, it took me a long time to like make that connection. So I think when we bring it back to health and the health impacts of climate change, it really grounds like the reason that this is important for us to think about as physicians and others in the health space. And so to directly answer your question about, where this data comes from, there is actually a huge body of literature outside of radiology, of course, mostly looking at the impacts of climate change on human health. So that might be extreme weather events, extreme heat or temperature, also the effects of air pollution and air quality, particulate air matter, and so forth on multiple organ systems, multiple health effects, adverse health outcomes, death, morbidity, for example, but also in health utilization. So impacts in terms of emergency department visits and so forth. So that body of literature is robust. And what we've tried to pull out in the introduction section of this review is some of the health impacts that directly relate to the cardiovascular system and might impact our role as cardiovascular radiologists. So you can imagine if more patients are coming to the emerge with shortness of breath, and they might have more cardiac or thoracic imaging, for example, we might see higher prevalence of disease if we have worse air quality, for example. So there is a direct tie to our work as cardiovascular imagers. And so I think it's really important for us to kind of like make that connection.
Savai, when you were introducing yourself, you had mentioned some efforts that you've done from the perspective of water and water sustainability. I will say that most of us in the cardiothoracic imaging community perhaps have a more narrow understanding of the impact of environmental effects on cardiovascular health, primarily through, frankly, pollution. That's really the main thing that we see here in my practice. Can you perhaps highlight things beyond air pollution and air quality that may be affecting cardiovascular health?
Sure. Of course, globally, there are a lot of areas in the world where water access is just a hard issue. And, this can affect health in many ways, including your cardiovascular health. And there are places where, people have to walk many miles just to get some clean water. And many times this water isn't necessarily clean. And so this can affect your health in many ways. And these are some of the issues that, many people are working on. But, and as Kate has mentioned too, um, areas where there's more disparity in your your economic ability, people are hit harder by climate change, and so it's unfortunate that there are these people in the world where it's a much more difficult task.
I just want to highlight something Savai said that I think is really important in that this acknowledgement that we are all impacted by climate change, but it's not equal. And of course, groups that are already disadvantaged, either because of their socioeconomic status or more vulnerable populations, younger and older patients, will be impacted the most severely. And often those groups have actually contributed the least to climate change. So there is the potential for this massive exacerbation of existing health disparities. And I think it's really important that we think about the flip side of that, that this is a tremendous opportunity for us to address and minimize those health disparities if we can directly address those. And so, access to clean water, as Savai alluded to, is really important. We also want to think about people who live, of course, in climates that are already hotter at baseline and now will be experiencing increase in average temperatures, but also more frequent and extreme heat events is really important. And those can, of course, directly impact the cardiovascular system and outcomes.
Perfect. I think we've set the stage well as to why we should care about the impact of climate change on cardiovascular health specifically, or really just healthcare in general. Let's move now to what I think the bulk of the review paper was in terms of how it focused on the environmental impact of cardiovascular imaging itself and potential methods by which we can mitigate some of that impact. Before we jump into each of the modalities, I'd like to get more of a big picture. So, what types of imaging studies are the biggest contributors to the environment, to climate change? And y'all can respond in whatever metric you think is most appropriate to qualify and quantify that.
Sure. So we actually have a great figure in our paper, figure 4, that kind of lays out the greenhouse gas emissions per testing modality. And one caveat is obviously sustainability is a very hot topic now, but that means that we don't have that much information about all of these. So a lot of the numbers are more estimates. And so we are very interested to continue studying this and hope that more literature gets published, so we have better data of actually how much emissions and energy these modalities use. But kind of the highest ones used that use the highest number of greenhouse gas emissions include any interventional imaging, PET imaging. Then we go to MRI and SPECT, then go down lower to CT, ultrasound, and X-ray. And so some of the higher energy uses like interventional and PET can use up to 200 kilograms or emit up to 200 kilograms of carbon dioxide, which is equivalent to around 600 miles driven by a car. And so, that's just from one exam. Obviously, each hospital is doing many of these exams every day, and we have so many hospitals, and so that just adds up. So it can really be a major hit.
I think that analogy will definitely strike with our audience members who may not have as much familiarity with what a kilogram of carbon dioxide means, but in terms of miles driven, many of us do exactly that. So 600 per examination is pretty drastic. That's for the highest producing exams estimated, that is correct, the interventional examinations.
Yeah, exactly.
What sort of order of magnitude difference are we talking about between those versus, say, MRI or CT that you had mentioned?
Yeah, MRI will be about a tenth of that. And, X-ray at the lowest is just about 1 kilogram of carbon dioxide per test, which is about 2 miles of car driven. So again, not very much, but all these little bits add up. And if you're going to do a bunch of X-rays and then on top of that another MRI, we might want to be judicious about which imaging we actually want to use.
I'm sure Kate can attest that the number of radiographs that we perform and read relative to the number of CTs and MRIs will certainly cause either equivalence or larger contributions in totality of those types of exams, despite them in isolation or per exam being a small quote unquote contribution. Very interesting. Kate, any comments on these ideas behind the contributions of each of these exams to greenhouse gas emissions in this example?
Yeah, and thanks, Sarai, for laying the groundwork so beautifully. I think maybe I can just like summarize it at a high level. As the take-home point is that I think it also makes intuitive sense that like our cross-sectional imaging modalities, those that you just look at the piece of imaging equipment that acquires the exam, and it's like a big piece of equipment. You can imagine it has a huge power draw. Versus a piece of X-ray equipment is much smaller in size and scope, and you it kind of makes sense that it would have a lower power draw. And so really, again, those cross-sectional imaging modalities use much more energy that typically will translate to more greenhouse gas emissions. I think the one point I just want to emphasize is that, as Subhai said, we have relatively few data points to base this on right now. Some of this is based on direct power logger measurements, like on the equipment itself. Some of it is based on modeling and life cycle analysis. So there's a couple ways to do this, and I think this is a tremendous area of research interest, and we are going to see a lot more papers coming out. So hopefully we'll have more refined estimates. I also just want to acknowledge, and we touch on this later when we talk about things to do to improve sustainability, but it's probably important to make it explicit here, is that there's variability. So especially in interventional procedures, you can imagine, a very short procedure that uses limited fluoroscopy time would have a much lower environmental impact compared to like a very long, complicated endovascular aortic procedure. And so again, I think just acknowledging that it's not like a one size fits all. And we've done our best to summarize the existing literature, but these are estimates.
Excellent. And before we get into some of those techniques to help mitigate some of that impact, perhaps we can talk about the perspective of us imagers in our conversations with our administrators or the equipment owners, and how we can utilize these ideas behind sustainability as more than just a general concept, but perhaps as a metric of quality. Could y'all flesh that idea out a little bit more?
Thanks so much for asking us about this. I think this is a really helpful construct and is something we talk about in our paper and others have, of course, as well. Often when we think about quality in healthcare, we might think about quality adjusted life years, for example, or some other metric in terms of how have we improved patient health over the financial cost, often in dollars. But I think we can expand that. And there's several ways to think about this. But as we kind of talk about in our paper, we could talk about that denominator being broader than just the dollar cost. So we can talk about the environmental impact that directly relates to sustainability. What are the greenhouse gas emissions of MRI versus ultrasound, if both of those could be used to investigate, cardiac function, for example? but also the social costs. Do patients have access to it? How are we addressing those determinants of health that we talked about before? And so I think about this kind of broader concept of quality and value, and thinking about that. And of course, this kind of directly relates to some of the work that has been done in finance and other industries in terms of ESG. And so thinking about that entire governance structure, not just about dollars earned or saved and so forth, but also that broader context, the social context and the environmental context.
Before we get into the more granular ideas behind different types of sustainability efforts in the context of imaging, could y'all talk about perhaps strategies that I and other imagers that are out there can use to help bring these ideas up about utilizing sustainability as a quality metric? The minuscule conversations I've had with my own personal administration have not been so fruitful because perhaps I just don't have the knowledge base. Any tips or pointers?
So, one of the main reasons that these take up so much energy is just, the power usage of things being on all the time. And one thing that we note in the review article is that by simply just turning off machines when they're not being in use, you can save a lot of energy. So, again, this directly ties into reducing the amount of greenhouse gases emissions, which in turn can potentially help patients' health. But if you're speaking with administrators, most of the time, unfortunately, talking about those real dollars and net savings, yes, is going to really what gets them excited and motivated. And so, if you may have other factors for why you want to be more sustainable in your practice, it's also good to mention how, yeah, honestly, a lot of these sustainability efforts not only are good for the environment and for people, but also good at saving money, which is, as Kate said, part of this broader base of what we're really helping with these kind of efforts.
I just want to emphasize like exactly what Savai said is like talking about the co-benefits. So like it's really hard to have these conversations if you're like talking about the kilowatts you'll save or even the greenhouse gases, but like bringing this down to like the level of whoever you were speaking to. So that collaboration and that highlighting the co-benefit of cost savings, for example, if you use less electricity, you usually save money, and really, linking that to the budget, but also linking it, as Savai said, to human health. So in health systems, like that is our overarching goal, is to improve, patient health. And so actually linking it back to the opportunity to improve and address those determinants of health, I think is really powerful as well.
Yeah, Savai, I think each party involved is going to have different motivations, like you had mentioned. And perhaps we can get a more concrete example now. I noticed that a recurring theme in how we can achieve sustainability from the perspective of imaging is with minimization or mitigation of energy consumption. Can you talk about some strategies that y'all highlight in the review or just strategies y'all are using personally to help mitigate some of the energy consumption that's done on the various modalities that we use in hospitals or in outpatient imaging centers?
Sure. As I was saying, simply turning off machines at the end of the day is, one great way to conserve energy. Also, if you're able to work with vendors and create power save modes that can, turn off machines to a basic level during the day when not in use, there's a lot of downtime where the machine isn't actively being used. And so that can be another area for energy savings. And then another aspect is not even just the machines themselves, but any workstation or computer or any other device that is being used in the hospital. If you're not using it actively, so many things are connected to the cloud now. So accessing data, you don't need your computer or the workstations connected over the weekend if you're going to check a few things at home. So these small things seem minor and maybe a small inconvenience at the time, but really can lead to a lot of cost and energy savings. And then another aspect is if we are able to collaborate better with vendors on different issues like this, there might be ways to develop automatic restart or shut down and turn on. So, if you want the scanner to be on at 7 a.m. on a Monday morning, hopefully they could be able to create a way to get that turned on right away at 7, instead of someone having to manually go in, start it, and wait the 10, 15, 20 minutes it is to get it all going.
Savai, you've hit the nail on the head with the challenge I've had in a couple of outpatient centers is how do we coordinate turning at least our CT scanners back on in time for the clinical workflow to begin? And it's more than just the equipment here, right? There's logistical workflows that need to be worked around. I do have a question less about CT, but more about MRI. I can't really turn some of my superconducting magnets totally off. Are there any methods by which we can reduce energy consumption either during examination or between exams to help with that? Kate, Sabai?
Absolutely. I just want to emphasize everything Savai said and to acknowledge that something you said, Praveen, that I think is really important is that there are multiple people and components involved, and we shouldn't. I certainly don't recommend that we kind of make these decisions in isolation and like just power things down and then hope for the best in the morning. So, one of the key collaborators here, and I'm laughing, I don't think anyone, I certainly not implying you would have done that. I hope nobody would have, but I think one of the essential collaborators on these types of initiatives, in addition to our scientists like Savai, of course, the imagers and our admin teams, which we've already talked about, is our technologists. We absolutely need to work together. So on our green team, I'm really fortunate locally that I co-lead it with a wonderful leadership partner who happens to be trained as an MRT. And so that's been really useful because you're absolutely right. There is an impact potentially, and sometimes we don't even recognize it in terms of scheduling and so forth, in terms of how long the equipment takes to come back up to a ready to scan state. Newer equipment is, of course, tends to have a mature ready to scan state. The vendors are well aware that sustainability is important, and they understand that is one very important metric. So to kind of get back to what you were actually asking about in terms of like other things we can do. So I think this also highlights the need for us to engage with vendor partners, either directly through research collaborations, but also just by asking them questions so that they know that this is something we are thinking about, both on the procurement side, but also as we are talking about kind of use phase. So what are the low power modes that they offer? What's in development? How can we implement them on our scanners, either through upgrades and so forth, or when we're thinking about purchasing new equipment? So that's really important. But there are some like practical things we can do pretty much across the board. We've done some work on shortening our protocols. So if your protocol doesn't take as long and you're able to kind of optimize that time so it's not just sitting idle in a ready to scan state, you not only reduce the time in the scanner, which patients tend to prefer, administrators tend to as well, again, if you can actually make use of that time, and less time in the scanner typically will lead to lower energy and lower greenhouse gas emissions. So we actually showed that in a recent study published in Radiology for cardiac MR. And that was a simple protocol change. And while the energy and greenhouse gas emissions we save per exam, per cardiac MRI was low, I just want to emphasize that don't let that discourage you. These are cumulative, right? So if you do 1,000 of this particular cardiac MRI protocol in a year, or even if it's lower, it all adds up and it's incremental. And of course, if you can inspire people to make that one small change at other centers, it's all cumulative. And so again, small changes can have a big impact.
I want to stick in that CT and MR space now, but move from energy consumption to another resource that has a lot of impact when it comes to its limitations and sustainability. And those end up being contrast agents and cooling agents. So many of us are very keenly aware, somewhat frustratingly aware, of the delicate supply chains of iodinated contrast, of gadolinium-based contrast, as well as the helium that we use to cool our superconducting magnets. So could we talk about the potential impacts of each of these resources, as well as how we might be able to conserve some of them when using them for imaging?
I think this is a great question, Praveen, and thank you for highlighting this, that it's not just about energy. You've highlighted that some of the components of our contrast and helium, of course, are finite resources, and so we need to think about conserving them and actually our ability to maintain supplies of them, not only from the kind of overt supply chain perspective, like, and the potential for it to be disrupted, like we experienced, of course, with CT contrast related to supply chain disruptions, but also in terms of the environmental impact. And so there's some very great research that's been done in this space, and I'll just highlight from other groups in terms of using lower contrast dose protocols, or optimizing our no contrast protocols. So I think in general, if you don't need to use contrast, it kind of relates to the ALARA principle. If you don't need to give contrast, don't do it. Use a lower dose if you can. And there's been some great work in that space. Also, tying in AI and the potential for it to augment signal to noise, for example, on a very low contrast MR, and so forth. I do think this is really important for us to think about and acknowledge explicitly that the supply chain, so those scope 3 emissions, are by far the largest contributor to overall emissions within radiology, within imaging, and healthcare in general. And so this is incredibly important for us to think about those components that are, upstream. They're indirect, and I think it's harder to talk about them. It's harder to think about how to do things because in some ways we're less in control. And of course, that's by definition. That's what Scope 3 refers to. It is really important to acknowledge that. So, we've talked about using less of them. And on the helium side, as we talked about for MR, there's a lot of work in terms of alternate cooling, and definitely that's been applied, implemented successfully on commercially available low field systems. And that's one of the benefits that has been talked about in terms of the sustainability of those. So those are some of the kind of the practical aspects. Some of those are more directly in our control versus others, but I think it's really important for us to continue that conversation.
On top of all of what Kate was saying, if there are strategies where we can do contrast recycling programs, and there's other research shown that tying back to water before, there's contamination of water bodies from these contrast agents emissions. So definitely anything we can do to conserve and kind of protect what we need is really important.
Excellent. Savai, I'm glad you mentioned those last 2 points about contrast recycling and ideas of spillage of these contrast agents into the water supply. And while I don't have much of an understanding of the potential impact, I'm curious as to what the consensus, at least at present, is amongst the experts out there as to why this is happening and what we should be worried about when it comes to gadolinium-based contrast agents in particular leaving the hospital water supply and entering the public water space.
I think the question is more just unknown at this point, as we try to avoid using gadolinium contrast in pediatric patients. And if all the kids in one area are getting gadolinium through their drinking water, that, is avoiding the point of trying to prevent them from getting any excess gadolinium that we were trying to avoid in the first place.
Excellent. Okay, well, I think we've gone through a lot of topics in CT and MRI. I want to shift now to a different modality that we were mentioning a bit earlier in the conversation, which is nuclear and interventional cardiology and radiology. So, helping implement some of those mitigation strategies that we were mentioning feels like it requires coordination amongst far more industries than just the hospital itself. Our nuclear cardiologists work with radiopharmacies and radiation waste managers. When we build facilities, we interface with a lot of our architects and structural engineers. And in our interventional radiology side and cardiology side, there's surgical tool suppliers that we don't really have that much control over individually. So, how can we as individual clinicians and scientists affect change across so many different players and industries?
I think, if we think about it like that, it's a huge problem, and no one individual is going to be able to make a change. But it all starts from small steps and small conversations. So if sustainability is important to you, which we think it should be for everyone, whenever you're interfacing with industry, with admin, with other users, just talking about the sustainability practice and thinking, what could we do to make this a more sustainable workflow? And just by doing those small things, we can start at least having it in the back of our mind. So when purchasing decisions happen, we are thinking about what is a better alternative to use. And of course, this is going to require a lot of collaboration. As Kate was mentioning before, all of the imaging that we do is very multidisciplinary and uses a lot of different levels from the manufacturers down to the technicians. And so everyone involved really needs to be on board at some level to sustainability efforts and working together as a team on this.
Excellent. Kate, any comments?
I just want to emphasize exactly what Savai mentioned, the need for us to collaborate even outside of our direct imaging departments. So you're totally right, Praveen, when you alluded to the fact that some of the work that, quite frankly, needs to be done, has to happen beyond like the direct borders of our department. And so I think it's really important we put together green teams or sustainability teams or whatever you want to call it that have broad representation. And I just want to acknowledge one of the reasons we talked about all of the imaging modalities in our review rather than maybe just focusing on CT and MR, which we might, maybe is more directly related to some of cardiovascular imagers' roles, is because there's themes that transcend it all. And one of the things we haven't yet talked about that I think is important is the concept of low value imaging. And so if we talk about, the different cardiac imaging modalities, one thing from a large health system perspective that requires us to engage with our referring clinicians is thinking about optimal tasks for a given patient and a given indication, and ensuring that we're not only choosing the right test for the right patient, but only doing imaging when it's indicated and has the potential to change management or improve care, of course, impact prognostication and so forth. And so I think that concept is really important. We haven't touched on that yet, but you're absolutely right. There is a lot we can do. I just want to ensure listeners feel empowered to make changes, that they don't feel that this is too big of a problem. So I want to bring it back to a concept that I've kind of recently been introduced to, and we didn't talk about explicitly in the paper, but I think kind of relates to what we did talk about, and that is urgent optimism. So rather than feeling like this is a huge problem and it's beyond me and there's nothing I can do, acknowledging we have a problem, but also talking about that there is a lot we can do. And that might be some of the small things we talked about before, all the way up to creating teams and trying to make some of these bigger changes by working together. So I think that's really important. I really want listeners, hopefully, to feel that there is a lot they can do.
I love it. Urgent optimism. And I think that y'all have laid the groundwork, as have many of the scientists that have contributed the data to support this review that y'all have published, in figuring out strategies that we can use, both small and large, to help mitigate some of the impact that we have as clinicians in treating these patients. That said, I love the optimism part, but I do want to address potential counterpoint that I at least often encounter. And that's the opposing perspective against sustainability in light of trying to do what is quote unquote best for the patient. So, what I often encounter is clinicians who state that sustainability efforts may be in contrast with what we're trying to do for the best of the patient. It may be potentially depriving patients of the care that they need. How would you respond to criticisms like this? I want to hear from both of you on this.
I think this is important to address head on. So I'm so glad you asked us. And I would counter that I do not think sustainability is directly opposed to providing adequate patient care. And actually, on the flip side, I actually think environmental sustainability from a broad planetary health perspective means we actually need to build capacity. We need to do them in parallel. And one of the reasons I just want to bring it back to the health effects of climate change is climate change impacts human health, as we talked about in the beginning. It impacts the cardiovascular system. We expect to see, more frequent or changing patterns of cardiovascular disease that may lead to more cardiovascular imaging. So we explicitly actually need to build capacity at the same time. So we can bring it back to the concept of sustainable value. If we can shorten our protocols and get the same diagnostic information, for example, in a shorter time, we can use that time in the scanner to scan another patient, for example. Someone might say, well, then, you're using more imaging, but the numerator is the patient, right? Just think about the value we provided. Now we've provided value to two patients, for example, right? So we have to think about that capacity building. So again, I totally acknowledge, this argument that gets used, but I think in some ways it may be used intentionally or not as a deflection tactic. And so I think it's really important to tackle it head on and to actually say, the bottom line is that we actually need to build capacity, not just within our own health systems, but also to address those health equity issues on a global scale.
Excellent. Thanks, Kate. Subhai, your thoughts?
Yeah, I just wanted to add on that, and we mentioned this in the review, that we don't want people to not do an imaging test because it'll save energy, to not do it. We still want people and patients to get the best care. So do the imaging test that you need. But it's something that we need to think of more holistically, of how to improve all of our tests and improve our workflows to aid in supporting sustainability efforts overall. And, as Kate was saying, let's say we have an MRI scan that takes half the amount of time. Not only is this good for sustainability, but you're more likely for patients to be okay and happy to get that MRI scan. I feel like a lot of patients are claustrophobic, don't want to be in the scanner, might not even show up for their scan. So if we have better sustainability efforts in, reduced scan time, this can also help patient care as well, which, goes against the ideas that being more sustainable inherently is contradictory to patient support.
Awesome. Well said, Savai. Completely agree. And that is super helpful information, at least for me, and I presume for our listeners too, who do encounter some of these opponents to these types of efforts. And these are great methods of framing the conversation to help understand parallel ideas that are going on here. I think we've covered a ton of ground here. And once again, super kudos for the contribution of this review to the journal and really to the science altogether. Do y'all have any final thoughts before we conclude?
I don't have any final thoughts, but I do have one question. Hearing about Kate's green team, I'd love to hear more about how you set that up, who's involved with that, and that might be a way for others to create their own green teams in their hospitals.
Thanks so much, Savai. And it's a work in progress. I'll just start by saying that. And so, we started very organically. Myself and the co-lead that I mentioned before, who's on our admin team, got together. We put out a call, and I think we're pleasantly surprised by the amount of interest and engagement. And so it's really snowballed from there. There's probably not a one size fits all, but that's how we approached it, and we're still learning. Well, hopefully, we'll have an opportunity to present on that at RSNA, and just to highlight that there will be a dedicated session on green teams at RSNA in the educational program. And I think this is really important for us to think about, how do we actually make these changes? And as Praveen mentioned before, it can feel hard to think about doing these things by yourself. So having a team behind you really can support you. I want to emphasize that we talked a lot about mitigation, which is, reducing our environmental impact, and that is so important. I also just want to acknowledge the importance of adaptation and resiliency at the same time. So these can occur in parallel. They are not like opposing points of view or dueling perspectives, but I really think we need to think about them in parallel. And so I would encourage, green teams or sustainability teams to think about both, so not to have a narrow focus just on mitigation, but to think broadly. And so, adaptation can be some of the things we talked about before, like ensuring we have capacity for surges and imaging related to poor air quality, but also practical infrastructure things like ensuring our MRI rooms are watertight if we live somewhere that's susceptible to hurricanes. And so this can directly relate to some of the preparedness planning that might already have been done in departments, but it's really important to think about it and link it directly to sustainability.
Fantastic. Kate, Savai, thanks again so much for coming onto the podcast, giving all of us your time and obviously the expertise you put into the review paper itself. So super, super thanks and big kudos.
Thanks so much, Praveen.
Yeah, thanks for having us.
Of course, thank you all again. And to our listeners out there, of course, thank you for tuning in. If you like what you hear from us on the podcast, please rate, review, and subscribe. That helps others out there find this amazing content from wonderful scientists and clinicians like Savai and Kate. This is the Radiology Cardiothoracic Imaging Journal podcast, and we will see you next time.